Hi, friends.
It's 2 o'clock. Yeah.
It's 2 o'clock. Again, we probably won't wait for a whole bunch of people to jump in before we just get into it, because you can always replay this, go back to the beginning, catch whatever you missed. So I'm Kelsey. This is Krista. If you want to know who the fuck we are and why we think we have any credibility talking about sexual health, we will link after this video ends our little introduction. I have 2 big disclaimers to make before we get started. The first is we aren't doctors. So we heavily researched this little episode, and all this information comes from the CDC and from Planned Parenthood. We think it's good, valuable information, but we aren't doctors, so there's that. Second, UPS has given us permission to do this live series. However, we don't represent UPS. They don't endorse this page, nor do they endorse our opinions. So today is the first part of a 3-part series that I'm super excited about, that's all about sexual health. Yay! So today we'll be talking about STIs. There are sort of 3 parts as I think about sexual health. The first is knowing some stuff about STIs and risks, and then knowing about barrier methods, safer sex practices, how to mitigate some of the risks associated with having sex with other people. And then the third is how to talk to partners about safer sex practices. So that's kind of how we've broken up this series. So today we will just be talking about STIs.
Right. So yeah, just kind of the basics of like, what are they? What can you look for with them? Usually nothing. And then so like we'll cover like testing and window periods and barriers and all that statistics later on in the series for sure.
Yep. So did you want to say a little thing about stigma?
Yeah. So one of the things we wanted to talk about on this is how the stigma associated with STIs is oftentimes worse than the disease, and we'll talk about the statistics kind of involved in how prevalent they are and why we shouldn't be afraid of them. We'll also talk about like how curable they are and the treatment for that. So yeah, there are lots of like TED Talks and various information out there if you guys are interested in learning a little bit more about the stigma, but we definitely wanted to touch on the fact that STIs are not scary. They're basically cooties, and the idea of them is oftentimes worse than what we're dealing with. So if you guys have any questions on that, feel free to chime in. And like, I know I'll talk about what I have, and I have no idea about your history actually. So, but yeah,
2 more other disclaimers. I'm just filled with disclaimers today. So, like Krista said, most STIs are curable or treatable. However, STIs there are higher risks associated if you have certain issues with your health. So for most people with normal immune systems, getting an STI, going and getting antibiotics, having it clear up, likely not that big of a deal. If you're immunocompromised, if you're pregnant or planning on becoming pregnant, there can be a lot more complications and risks associated with having an STI.
Right.
So, it also is about your own health and knowing your own body. So there's some words we're going to use that aren't my favorite words. So we're going to talk about normal, healthy adults. That's language basically from the CDC. The other thing is, I generally, when I like to talk about sexual health, and I think probably Krista does this too, tend to talk about people who have vulvas and people who have penises rather than using gendered language, because we are citing statistics. I don't want to take those statistics out of context, so I am going to talk about prevalence rates in men and women. We're going to talk about the risk for men who have sex with men being higher. Again, generally, when I talk about people having sex, I prefer to just talk, because genitals don't always, genitalia doesn't dictate gender, but because we're citing statistics from the CDC, we're just going to use their language.
Yeah, mostly, and we'll try to be like cater to that when we can, and be mindful of it. But certainly when we're citing statistics, the statistics that we're citing are public statistics. We don't want to mess with those at all. So we're going to use the language that they use.
And before we jump in, to sort of going through symptoms and transmission and whatever else, I just want to talk a little bit, just touch on the stigma piece, because like Krista was saying, we treat STIs sort of as this big scary thing that's very different than any other health thing. And I would say like 3 years ago, I went to a really fun event with 2 of my partners. We hooked up, we had a great time, great romp. We all got home to our respective homes, and we all ended up with strep throat. And we all went to the doctor, got on antibiotics, sent each other flowers, sent each other baskets of soup, and we're on the phone giggling about how much fun we had together getting strep throat. And I always think about that, because if we all would have got home and gotten tested and realized that we all got chlamydia together, I don't know that we would have been as lighthearted about it. But again, like, sexually transmitted infections, you know, are just another health condition, just like strep throat, getting the flu, getting a cold.
Right. Yeah, and I mean, like, to kind of touch on that too, is everybody's always like, oh my gosh, we have to take all these precautions not to spread these STIs around, not to, like, you know, make sure that our partners are safe. And when we talk about like colds or like just getting over pneumonia, like pneumonia can be seriously life-threatening to some people, but yet we're not really as careful about like kissing or hugging or coughing in front of people as we feel like we are with STIs. Like that oftentimes, like the fear of it dictates a lot of what we do.
Right. And it's a great thing to take steps to protect your partners. And in our next series, we're going to go through all sorts of barrier methods, boundaries, different ways to be sexually active with your partners while minimizing the spread of sexually transmitted infection. We just want to talk about, we just want to say up front, like, we think about risks associated with sex so much differently than we think about any other risk. So for all of the infections we're going to talk about today, the prevalence rates of these infections occur less than how often people get injured in car accidents.
Yeah.
And every day we get into a car and we put on our seatbelts, we try to be safe drivers, we use our blinkers, but we take risks knowing that, people get in car accidents, but you still get in the car. And people treat sexuality so much differently than that. So I'm going to give you a statistic up front, and then we're going to just jump right in. So the car accident injury rate is 761 per 100,000. Now that's probably a number you're not going to remember, but I'm telling it to you because it's higher than any of the other prevalence rates we're going to give you today.
Yeah.
So just to put in context how scary, how prevalent, how abundant sexually transmitted disease is, I just kind of wanted to give that number right up front.
Yeah, we'll kind of remind you of that a little bit as we go on, but just to kind of give you an idea.
Yeah, so first we're going to talk about chlamydia. So just to give you a little bit of an overview, the prevalence rate of chlamydia in Utah is 332 per 100,000, which is lower than the national average, which is 528 cases per 100,000. In this sexually transmitted infection, there are higher rates of new infections among women than there are among men. It's an infection that is easily curable with antibiotics. So chlamydia is spread through fluid to membrane transmission. So it can be contact from sexual fluids with the vagina, mouth, or anus of an infected partner. And more infrequently, it can be transmitted through oral sex. It's less common to transmit almost all of these infections through oral sex, but particularly with people who have immunocompromisation. Is that a word?
Yeah, it is.
It makes it easier to get a sexually transmitted infection in your throat.
We do have a question. The question is, what period of time are these rates over per year?
It is per year, I believe. I will fact check that, but I am pretty sure it's per year.
Yeah.
It's new rates per year. So chlamydia can infect the genitals, rectum, throat, and eyes. Again, incidence of infections of chlamydia in the throat and eyes is really, really rare, but it can happen because eyes are a membrane, your throat is a membrane, just in the same way that your vagina or rectum is a membrane. The majority of people with active chlamydia infections are asymptomatic. So that is a reason why it's important to get regularly tested. We're going to go over the symptoms, but a lot of people who have chlamydia don't have any symptoms, and that is not uncommon with other sexually transmitted infections as well. So the symptoms of chlamydia are pain and burning while peeing, pain during sex, lower belly pain, abnormal vaginal discharge, bleeding between periods, pus or a watery milky discharge from the penis, swollen or tender testicles, and pain, discharge, or bleeding around the anus. Again, chlamydia is curable with antibiotics, but if left untreated, it can cause pelvic inflammatory disease for people who have vulvas, and infertility. Infertility can be caused by pelvic inflammatory disease. It can also create complications in pregnancy and can increase the risk of acquiring HIV. So the most common test for chlamydia is going to be a first stream urine sample where you pee in a cup. However, if you are somebody who is concerned about having a chlamydia infection in your throat or a rectal chlamydia infection, there are also rectal and pharyngeal tests that you can request from your doctor.
Yeah, and just to clarify too, I do believe, and correct me if I'm wrong, that the first stream urine sample only counts for people who have a uterus, that the people with a penis need to get it swabbed.
I think that's right.
Yes. So, and just to put that into perspective a little bit too, when you go on the internet too, like another disclaimer, when you go on the internet, you're going to see the worst case scenarios. And most people are adults and they're going to go and they're going to get tested and they're going to treat it and like all that stuff. So a lot of the symptoms that we're talking about are really if it is left untreated for a long time. And again, most people don't have symptoms at all, regardless of if it's left untreated or not. So it's really important to go in and get tested. Yeah. So we'll move on to our next one unless there are any questions on that. We're just gonna kind of spew a whole bunch of information at you. So feel free to watch this video again. It will save. You can find it on the website, all that stuff. Gonorrhea. Gonorrhea is the next one. So we're looking at about 172 cases per every 100,000 in the US, and about 83 per 100,000
In Utah.
In Utah, okay. This one is really kind of complicated because there's new information coming out that talks about an antibiotic resistant strain of gonorrhea. So while it is treatable, they are having new cases that are showing that it's not responding to antibiotics. This isn't to freak anybody out. This is still like really rare and it's still something that you should treat and that they are treating, and that doesn't really have any like major health problems, again, unless you're immunocompromised. But just to be aware of it. There is a higher rate of new infections among men. What does MSM mean?
Particularly men who have sex with men.
Oh, yeah, okay. She's using all these things on paper.
Acronyms. The worst.
So our methods of transmission are it's usually spread through contact with the penis, vagina, so penis and vagina, mouth or anus of an infected partner. Mostly through vaginal intercourse, anal sex, and then more infrequently, like we were talking about with chlamydia, oral sex. Gonorrhea can affect the genitals, rectum, throat, and eyes. So that's super fun, interesting fact about this, that you don't just get it in your genitals.
Again, infections of the throat and eyes, super rare.
Uncommon, yeah.
Most commonly, infections in the genitals.
Yep. And many men and most women with active infections are also asymptomatic. So you're going to be hearing us talk about this a lot. This is the case with most STIs, that most people who have them do not develop any symptoms ever. If you do develop symptoms, these are what you can look for. So pain and burning while urinating, and abnormal vaginal discharge that may be yellow or bloody. Bleeding between periods, yellow, white, or green discharge from testicles, itching or discharge from the anus, pain while defecating, and a sore throat.
So sore throat if you have an infection in your throat.
Again, those are super uncommon. Yep. The complications that can arise if left untreated can be the pelvic inflammatory disease, like we talked about earlier, infertility as a result of that, arthritis, weirdly enough, because you can develop it it can affect your joints, and then life-threatening blood infections in very rare cases, and then, of course, an increased risk of acquiring HIV. The standard test for this, it is included in a standard panel, is the same as chlamydia. Oftentimes they will actually just take the same sample and use that. So it's the same, a pharyngeal or rectal swab. For people with a uterus, it's a first stream urine sample. And then it is just treated with antibiotics if you have it and you test positive. It's super easy, minus the drug-resistant strains, but again, those are super rare and they're working on that. So 30% of new gonorrhea infections each year are resistant to at least one drug.
So not that rare. Not
that rare, but the thing is just at least one drug doesn't mean that it's resistant to everything and you're going to have it for the rest of your life. It just means that they may have to be a little bit more creative about how they treat it, and they're still going to treat it with antibiotics. It just means that it's getting a little bit better at fighting us off, but it's still winning.
Bacterial infections, one of the things that happens in the medical community that's very well known is that bacterial infections are competing to catch up with the antibiotics that we use to treat them. And so what we've seen actually since HIV has become more controllable and PrEP has come onto the market. PrEP is pre-infection prophylactics. I may have given you the wrong, it's PrEP. Look it up. I don't know.
We have it later. We'll talk about it.
Yeah, we'll talk about that. We'll talk about it later, and we'll also talk about it and how to prevent some of these STIs. But as people are become less concerned about HIV because there are more treatment options and there are more prophylactic options, we saw some condom use go down, and as a result, rates of gonorrhea infections increased slightly. Over the last few years, particularly among men who have sex with men. And in that community in particular, we are seeing these antibiotic strains of gonorrhea. And so, again, STIs aren't scary, but we do want to prevent them because in the same way that sometimes you can get a antibiotic resistant staph infection, which is referred to as MRSA, there are also some antibiotic resistant sexually transmitted infections.
And this is the case kind of across the board in the medical industry right now, as we're seeing these pop up all over the place. It's not just in these really in crazy scenarios, which is the reason that doctors tell you to finish out your antibiotics every time you do it, because then you're not, participating in crazy bacteria-resistant strains.
Okay, so I'm just going to super quickly talk about hepatitis A and B and then jump into HIV.
Yeah.
We're only going to go over these quickly because one, there's a vaccine for them, and two, they are very, very rare. So the CDC estimates that there are 4,000 in total new cases of Hep A and 21,000 new cases of in 2016, there were 4,000 new cases of Hep A and 20,000 new cases of Hep B as a result of sexual transmission. So that's a very, very tiny percentage. There are vaccinations for both hepatitis A and B that you may have already gotten when you were young. I know I did. You can always check with your doctor if you're concerned about hepatitis A and B. Hepatitis A is transmitted primarily through oral fecal contact. So only 7.3% of new identified cases involved sexual or household contact. Hepatitis A does not become chronic or cause long-term liver damage. If someone becomes symptomatic, it may be relatively mild and pass in a few weeks, or may be severe and lasting several months. Symptoms include fatigue, sudden nausea, abdominal pain, and fever. So hepatitis A is one that you might want to consider if oral rectal contact is part of your sex practices. It's not uncommon, and also if you're eating pussy, there might be some oral rectal contact in there. So it might be just one you want to think about, but again, super rare. Hepatitis B is highly contagious and transmitted through body fluids, including vaginal fluids, blood, and urine. Hepatitis B can be acquired through vaginal, anal, or oral sex, sharing toothbrushes and razors, and sharing needles. Hep B is usually symptomatic but can cause symptoms similar to those caused by Hep A. Hep B, however, can become chronic and cause serious liver damage. Again, there are vaccines available for both these things, relatively rare, and kind of like HIV, can be transmitted both through blood as well as sexual fluids. So if you use intravenous drugs or have a partner who uses intravenous drugs, it's one to think about and just be aware of, but you can always speak to your doctor about a vaccine as well. So HIV and AIDS, I'm going to give you a little bit of an overview on prevalence. This is the sexually transmitted disease that sort of there's the most fear around, and for reasons,
right?
For reasons, you know, in the 80s, people died of AIDS because we didn't know what it was. Now, if you are HIV positive and treated, your viral load can be down to 0, where you basically are non-infectious, and you can live a full, healthy life. Mm-hmm. So,
well, and in a lot of cases too, people who are positive for HIV or AIDS are going to the doctor more often, so they actually can sometimes live healthier lives than people who aren't going as often or who don't have them.
So the rate of new diagnosed infections in 2016 was 12.3 per 100,000. So in 2016, there were an estimated 38,500 cases.
And I just want to quickly remind you of the statistic that we had for the car accident is 761 per 100,000. So that's a big difference.
Versus 12.3 per 100,000. So it's HIV is most frequently transmitted by male-to-male sexual contact, followed by heterosexual sexual contact, and then IV drug use. New infection rates are highest among African American men who have sex with men, followed by Hispanic men who have sex with men, followed by white men who have sex with men, and finally, Black heterosexual women. And if you're interested in why these communities are more at risk, there's tons of information available about that online. So just Google it. Yeah. HIV destroys cells in the immune system called T cells. AIDS is late stage HIV, or when the immune system is so damaged that one becomes prone to dangerous infections. HIV is carried in semen, vaginal fluids, blood, and breast milk, and can be transmitted via vaginal or anal sex, sharing needles, getting an HIV-infected blood transfusion, and semen or vaginal fluids or blood getting into open cuts or sores. And I just want to pause for a second and talk about the risk of different types of sexual activity. So HIV can be transmitted through vaginal intercourse. The reason why we see slightly higher rates of transmission via anal intercourse because the membranes in your anus are so much more delicate than the vaginal canal, and they're prone to
tearing. They oftentimes tear.
Yeah, and so that's why we see slightly higher rates. The medical community considers anal sex to be a higher risk sexual behavior for acquiring HIV. It can take up to 10 years for HIV to show symptoms. The first 2 to 4 weeks after infection, one may feel flu-like symptoms.
May.
Not necessarily. So, and I want to talk just about undetectable HIV levels, because there is a stigma that a lot of people feel like they would never want to have a sexual partner who has HIV. And this is kind of the case with all STIs, is people tend to go, oh, I want my sexual partners to be clean. There's no such thing as clean. And people who have STIs or have had STIs or currently have some type of ongoing infection aren't dirty. And in fact, people who don't know that they have acquired a sexually transmitted infection, whether that's HIV or chlamydia, means that they're more likely to actually pass on the infection because they don't know. So they may come to you and say, oh yeah, I'm clean, because they don't know, maybe they haven't gotten tested in 3 months, they're going to get an infection. And so we now know with pretty good certainty that people who are HIV positive, being treated, taking their medications, and have undetectable viral loads, where they go in and they get tested for the virus, and their viral load is essentially 0, cannot transmit HIV. So in a lot of ways, people who know their HIV status and are getting treated are potentially safer sex partners than people who don't know their HIV status, aren't taking protective measures, or aren't getting treated, right? So undetectable is uninfectious. HIV is not curable, but it is treatable. People living with HIV who are taking antiretrovirals as prescribed can not only live long, healthy lives, but can reduce their viral load to the point that is undetectable, and they are essentially virus-free, therefore it's not transmittable. There's also a new type of medication called PrEP, or pre-exposure prophylaxis. The brand name of this drug is Truvada. It can reduce the risk of acquiring HIV from an infected partner by more than 90% and is recommended for folks with certain risk factors or who have partners who have HIV.
Long-term partners usually,
yeah. Generally long-term partners. But I've had doctors ask me if I wanted to go on PrEP, because there were times in my life where I had multiple sex partners, and not just 2 or 3, but multiple sex partners. And some of my sex partners were men who had sex with men. And so, you know, I had all of the risk factors essentially for that would make me a good candidate for PrEP. At that time, I chose that I didn't want to go on to PrEP. I was pretty confident with the barrier methods that I was using, and being selective about what types of sexual behaviors I was engaging with certain types of people. You know, I don't really like anal sex, so I don't have it. And I use barrier methods with my partners, which we'll go into, which really reduces transmission rates. But PrEP is not just for men. It's not just for gay men, and anyone can sort of meet the qualifying risk factors to be a good candidate for PrEP. So if you have concerns about HIV transmission, definitely talk to your doctor, because it's really an amazing tool to help reduce rates of HIV transmission.
Yeah. And I want to go back for a minute and touch on this. I meant to touch on it at the beginning and totally forgot, but the language that we use in general around STIs and that stigma of it is really, really important to be aware of, and to use consciously. This idea that, like, yeah, I'm clean implies that somebody else is dirty, and that just adds to the stigma of it, which doesn't help anybody, because it makes people afraid to go get tested. It makes people afraid to say, like, I have something, and be honest with their partners about it, because they're not sure of the reaction that they're gonna get. So just make sure you're being conscious about the language that you're using around STIs.
Oh my God, we're at 28 minutes. You guys, we're so fucking chatty. Okay,
sorry.
We're gonna go faster, because I know you want to get on with your day.
I did want to talk really quickly too, though, about, I don't know if you guys have seen on the news that they found that the second official person has been cured of HIV now. And I wanted to talk about that because they haven't actually found a cure yet. And I wanted to be very clear on this, because some people, I don't know if people are reading up on this, but what happened was, it was somebody that was being, in both cases, and the last case was about 12 years ago. In both cases, it was somebody that was being treated for something else. In this case, it was for cancer, and they received a bone marrow transplant, which subsequently ended up curing the HIV. The doctors have come out and said that this is not a viable solution for everybody, that they can't do this to everybody. So they haven't actually found a cure yet, even though there are people who have been cured of it. So I just wanted to touch on that real quick. Next, herpes, also known as HSV. HSV-1 can cause oral and genital herpes. HSV-2 can cause just genital herpes. So there are 2 types of this, but all of them are kind of under the general rule of herpes. This is a big one, because this is the one that the most stigma, I think, is around. And like, there are so many people that have this. It's kind of ridiculous. So 50 to 80% of US adults have oral herpes, and about 12% have genital herpes. So this is something that's so common and so prevalent, yet we have this like we're dirty, or like we're gonna transfer it to our partners, and what does that mean?
And basically they estimate that 100% of adults have been exposed. That doesn't mean you have it, but have been exposed to some type of HSV.
And this is the kicker. So most individuals who have HSV are asymptomatic. They don't get anything. Oh my gosh. What does that mean? I don't know. So people with asymptomatic infections can still transmit the virus, though at a lower rate than those with lesions. And transmitting the virus means that you can transmit a virus to the other person, and then they could become symptomatic. Like it's that weird with people. The infection is transmitted through skin-to-skin contacts, such as kissing, oral, anal, and vaginal sex. So it doesn't even need to be like fluid-to-fluid transmission. It's just skin-to-skin contacts, which is the reason most people have been exposed to this. And most individuals are asymptomatic and have very mild symptoms. Those who do experience symptoms may only have one outbreak, or they may have reoccurring outbreaks. And the first outbreak is often longer and includes more painful and visible lesions, as well as body aches, fever, and increased viral shedding, which means that you are more likely to transmit the disease at that time. Subsequent outbreaks, if they occur, tend to be shorter in duration and less severe. The complications include, for people with normal immune systems, the greatest concern is the shame and the stigma associated with herpes. And in fact, like if you go onto the CDC's website, and this is something that I learned from, I don't know if you guys have ever been to the Sensible Slut workshop that Jen Stoffer puts on. It's amazing. If you have a chance to go to it. But the CDC actually even puts out that they don't recommend getting tested for this because
the stigma is worse.
The stigma of knowing that you have it is worse than the disease. And oftentimes people don't even know they can go their whole life without knowing that they have the disease, and then getting tested just means that now you know and you have that stigma associated with it, which is the reason that it's not included in a standard panel, and you have to kind of fight your doctor on getting tested, and sometimes
you have to fight your doctor on getting tested if you've never had an outbreak. You have to pay for it out of pocket. It's very expensive.
It's very expensive.
And the reason is they're like, if you've never had an outbreak, we're not going to treat you. You can't pin it to who infected you, because you can have the infection for years and never be symptomatic. And so doctors don't like testing people for herpes at all.
Right. Yep, exactly.
Unless you're experiencing symptoms. That's like the big caveat. If you're experiencing symptoms, they'll absolutely test you.
The thing is too, is like, even the symptoms, it's like they're going to test you for it. And it's usually like a swab or a sample that they're going to take of it. But they're really just confirming like like they're not even confirming what you have. They're confirming like your risk associated with it from other things. Like oftentimes, and Jen talks about this in her presentation too, but she talks about kind of that the like what they're testing for at the labs is other like autoimmune diseases that could become complicated with this. So yeah, it's not even like a matter of you have it or you don't. Yay. And
antivirals can shorten or prevent outbreaks and reduce the likelihood of transmission. But really, herpes is a unpleasant dermatitis. It's essentially a rash.
Right.
Now, again, it can make you at higher risk for HIV infection. If you are pregnant or plan on becoming pregnant, there can be complications associated with a herpes outbreak during pregnancy. So I'm not saying for all people there's no risk associated with herpes. There can be complications associated with herpes, but for most people with normal immune systems, getting herpes is having an unpleasant rash.
Yeah. And
you may never have the rash and never know that you have herpes. You may only have it once, or you may have outbreaks throughout your life. But it is not, life-threatening. It is not, it's really not something that we should be worried or embarrassed about. It's not that fucking big of a deal.
If you're worried about like transferring it, or you have a partner that's worried about transferring it, there are things you can do to shorten the lifespan, or reduce the amount of outbreaks that you get, and reduce, even when you are outbreaking, reduce how likely you are to spread it. So there's lots of stuff that you can do about this too, to help it along. Okay. Yay.
I'm going to talk about syphilis, and I'm going to go through this really quick. Syphilis, we're seeing increases in rates of syphilis transmission. Now, those rates are still really low. You may know that we're seeing increases because there was just a get tested for syphilis poster posted on this page. The rates of syphilis in Utah are about 3.8 per 100,000 in Utah per year. So that may be slightly increasing. All of these statistics are from 2016. That was the most recent year I could find statistics from. Syphilis is one that people think of as being really scary, because it can be if it's left untreated. You can get tertiary syphilis, which is bad, but that is incredibly rare. So the infection is transmitted through contact with sores on the vagina, anus, penis, or scrotum, and more rarely the lips or mouth. Higher rates of spreading the infection. There are high rates of spreading the infection shortly after it's acquired. People often don't notice the sores because it's painless. The first stages of syphilis is the appearance of one or more sores. They call them cankers. These usually last 3 to 6 weeks, are painless, and may be difficult to notice. The second stage usually starts with the development of a rash on one or more areas of the body, sometimes large raised lesions in the mouth or groin. Sore throat, headaches, muscle aches, patchy hair loss, and fatigue can accompany these rashes. Tertiary syphilis is rare and develops in a subset of untreated syphilis infections. It can appear decades after the infection was first acquired, and can affect multiple organ systems and can be fatal. And like most of these sexually transmitted infections, an active syphilis infection can make it more likely to acquire HIV if exposed. Syphilis is curable with antibiotics. Regular testing is recommended particularly for men who have sex with men and pregnant women, because again, pregnant women can experience more complications with any of these infections. But more and more, I've found that, again, syphilis is one I kind of have to beg, borrow, and plead with my medical provider to test for, because it's so rare in the community. My medical provider was more willing to test me for it when I had 20 to 30 partners a month, is basically, unless I'm really willing to beg and pay out of pocket. At this point in my life, because I have so many fewer sex partners, I really only have a couple regular sex partners right now. They basically just say, we don't need to test you for it. And when we say that, it's not that anyone can't get syphilis. Anyone of any gender who has sex with, whatever your sexual identity is, can get syphilis. It's just that we see prevalence rates more in some communities and less in others. Do you want to talk about HPV?
I do, so much, yeah. So HPV is a really, really fascinating one, because pretty much everybody has it, like everybody, not kidding. So virtually anybody who's going to be sexually active is going to come across it at some point in their lives. This is one that I know that I have. And it's hard too, because there is no test for men, and there's very, very little data on this, because there's no test for men, and because they're not tracking it. So the biggest thing about this one is that it can lead to cervical cancer in women or in people with uteruses.
Certain types. There are lots of different types of HPV, tons of them.
Right, yeah.
There are a few types that put women and actually men at risk for certain types of cancers, which is why they're now vaccinating for HIV for both men and women. It used to just be women.
Yeah, sorry. So no, you're fine. So it also can be associated with genital warts. A lot of people don't realize that just because you have a symptom of genital warts does not actually mean you have HSV. You could have HPV too. And it is mostly asymptomatic. And here's the kicker: it mostly clears up on its own in most people too. So when I went in, the way that you test for it is going in and getting a pap smear done, and then they typically don't test for it unless you have an abnormal pap smear come back. And we'll probably do an episode at some point on annual health and include pap smears and stuff like that. So if you're curious, do some research. But yeah, but then they come back and tell you which strain of HPV you have, whether or not it's a high risk strain for cancer. And then basically they're like, let's do nothing. And they retest you every year. They redo your pap smear. In most people, it will just clear up on its own in a couple of years, and there's no big deal associated with it.
And to be clear, just there are certain types of HPV that put you at higher rate of cervical or other types of cancers. That doesn't mean that if you have HPV, you're going to get cancer.
Right.
Again, like Krista said, if you have an HPV infection, even if you have an HPV, a high-risk type of HPV, most of the time the body will clear the virus on its own. Within 2 years, you will be virus-free.
Yep. Yeah. Let's see, where was I at? Oh, there are vaccines for it. So there are new vaccines coming out all the time. Most of the vaccines, it doesn't vaccinate for every strain of HPV because there are like hundreds of strains of HPV, but it does vaccinate for the most high-risk strains. So I highly recommend, and they just extended the vaccine age, I believe, to 45. Please correct me.
But it's also based on the number of sexual partners you have.
And
so they want to
vaccinate
get you before you fuck a bunch of people.
Yeah, basically. So the younger you can do it, the better. There's like a window. Please go talk to your gynecologist.
Please
about
vaccinate
this.
your children.
Please vaccinate your children. But it's really interesting to know that there is a vaccine out there.
And it's available for both men and women.
Mm-hmm.
It used to just be women, and the period was like you had to be vaccinated by the time you were 16
Right.
years old. I think when I got it, that was the rule.
And oh my God, I love this because there is no test for men. So God, go get vaccinated. Why would you not?
Yeah.
Anyway. So the methods of transmission is spread via skin-to-skin contact, usually with a mucous membrane. So vulva, vaginal opening, penis, anus, mouth, or throat. Those are the big ones with a mucous membrane. I don't know why you would be doing something with like the ear, for instance, but who knows?
Ears, eyes.
And I think we covered testing. So this is like, again, pretty much everybody has this. It's one of the complicated ones as to whether or not you even disclose it to a partner because who knows? And we'll talk about that later, but.
Okay, so I'm gonna knock out 3 more really, really quickly. So we're gonna talk about trichomoniasis. Trichomoniasis is caused by a tiny parasite. It's really common. Only 30% of infected folks develop symptoms. It's more common in women than it is in men. It's spread through sexual fluids, vaginal sex, vulva-to-vulva contact, sharing sex toys, and can infect the vulva, vagina, penis, and uterus. Trich, if symptomatic, is most likely to cause bacterial vaginal infections or have similar to a yeast infection or a UTI. These include changes in vaginal discharge, blood in the vaginal discharge, itching, irritation, or swelling around the genitals. And trich is not a big deal. It's super easily treatable with medications, but has no long-term risks. So there are 2 more I want to talk about, and those are bacterial infections and yeast infections. So if you are a person with a vulva or a vagina, bacterial infections or bacterial vaginosis or yeast infections are not considered sexually acquired diseases. They're often sexually triggered infections. And so that means the vagina, the way it works, like every other part of our body, is there's a really delicate balance of healthy bacteria and yeast that keeps it functional.
Like with everything.
Like with everything else, like with your gut and with your throat and whatever.
Mm-hmm.
And so the way a yeast infection develops or the way a bacterial vaginosis infection develops is just when that bacteria yeast balance is thrown off. And
it
so
could be due to anything. Like it's
due to anything.
Note that
baths,
that this doesn't even need to be from
the
sex.
pH balance of your soap.
Yeah.
Also, like oral sex, like people's mouths are full of bacteria. It can really disrupt your the balance in your vaginal canal. And so that is a really common thing that a lot of women struggle with, and is one that can be sort of addressed with the same type of barrier methods that you can use to address all of these other sexually transmitted infections. So that's why I just wanted to mention it with this. Next week we'll go over, or not next week, next time we'll go over those barrier methods. Maybe next week, no one knows. We don't know what our schedules are yet.
We're so we're planning ahead. Yes,
planning ahead planners.
I also do want to quickly, this was a thing that I didn't learn until I was a lot older, that you do not need to have sex in order to get a bacterial yeast infection, that people who are virgins can totally get it as well. So
I started getting yeast infections when I was
it can totally come from all different things and totally treatable.
Yeah.
So yeah.
Yep. All right, you guys. So our next time we'll be talking about boundaries, barrier methods, and other ways to have sex that minimize the risk of spreading sexually transmitted infections.
We'll also be touching on like STI testing and window periods, all that information that you need to know.
So we're really going to try to keep these down to like 15 minutes. This one's 45.
Well, I'd say half an hour is probably good. I don't think we're going to get down to 15 minutes. Let's call it, let's shoot for half an hour next time.
Yeah, we're too chatty. We're too chatty. If you have any questions, if you have any corrections, like I fuck things up all the time, please shoot us a message. You can do it through the Emerology page. You can comment on this video. You can go to our individual profiles. We will be posting links to all of our sources and probably a document pretty similar to the outline that we used today so that you can go back and refer to this information. We will also post a link to our bio video so you can see why you should trust the shit we say or why you shouldn't.
I mean, we're not doctors again.
We're not doctors. So, and basically the moral of the story is sexually transmitted infections are a real thing. They're less common than we think they are. Many of them are easily treatable, but if there's something weird going on with your junk that just isn't the way it usually is, go to the doctor and get tested.
Oh my gosh, it's no big deal.
Yeah.
And start talking about this stuff more, because that's gonna help with the social stigma around it, and that's really what we need in our society, I feel like. So
yep.
Yay.
All right, bye guys. See you next time. Oh no, I always forget this part.